Okay, I'm just going to wash my hands here. Hi, I'm Caitlin. I'm going to be your nurse today.
Hi.
Hi, we're going to do a full head-to-toe physical assessment. Should take about 10-15 minutes. We've already taken your vital signs. So your blood pressure was 120/70. Your respirations were 16. Temperature was 97.8. And pulse was 68. So those are all within normal limits. It's all confidential, so if you have any questions, feel free to ask along the way. So is it okay if we get started now?
Yep.
Okay. Can you tell me your name, what year it is, and where you are at?
My name is Chandler Kraft. The year is 2016, and I'm in Farmington, Arkansas.
Okay, good. So what we're doing there is just determining your level of consciousness. So since you're able to tell me where you are, that's within normal limits, okay? So now what I'm going to do is I'm going to look at your skin, start out with the skin and the nails. So let me put this down here. Okay, so the skin is pink, warm, dry, and intact. Okay, and then we'll take a look at your nails here. What I'm doing here is just testing for the capillary refill and making sure there's no clubbing. The nails are translucent, trimmed, convex, less than 160-degree angle, and capillary refill is less than 3 seconds. So I'm going to need to do that on your toes as well. We're assessing the same thing here. Okay, so I'm going to just do the same thing I did on your fingers. And the toes look fine as well. There is capillary refill less than 3 seconds. The nails are, there's no clubbing. They're trimmed and translucent. So that's all within normal limits. Do you have any questions so far?
No.
Okay, perfect. Okay, so next we are going to move on to your head. So what I'm going to do is I'm going to look for any excessive oiliness or dryness. Make sure there's no lesions or parasites. And the skull is normal cephalic. The scalp is intact. There's no excessive dry or oiliness. There's no parasites, lesions. And the brown hair is thick. The eyebrows and eyelashes are evenly distributed. And on his face, the eyes are in the upper third of the face. The nose is midline, and the mouth is in the lower third portion of his face. So what I'm going to do now is, since I'm here, I'm just going to go ahead and what I'm going to do now is check the recoil on your ear.
Okay.
But first, I'm going to palpate over your targus and your mastoid process, and just tell me if you feel any tenderness, okay?
Nope.
Okay. Recoil is rapid. Small amount of serum in the ear, but there's no foreign bodies. Go to this side. Any tenderness here?
Nope.
What about here on your?
Nope.
Okay. Recoil rapid. Small amount of serum. No foreign bodies in either ear. Okay. So what I'm going to do next is if I was looking, I'm going to look at your eyes here and make sure look towards me. Okay. And then follow my pen. Good. Okay, there's no nystagmus. The eyes are follow direction. So everything there is within normal limits. Okay. Then next, I'm going to look up your nose just to make sure there's no foreign bodies, and that's Peyton. Can you take a deep breath in and then push out with your nose? Breathe out through your nose. Good. You don't feel anything blocking it or any difficulty, pain with that? Okay. Just gonna look up your nose and make sure it's patent. Good. Okay, no deviations. There's no foreign bodies. The nose is patent. So if you'll go ahead and open your mouth. Okay, gingiva, pink, moist, intact. Teeth are white and intact. Uvula is midline. Lift up your jaw. Okay, hard and soft palate, intact. Do you have any difficulty swallowing? Can you take a swallow for me? No pain, anything like that? Okay, perfect. So now we're going to do. I'm gonna have you kind of here. Let's have you sit on the stool here, and if you can go ahead and sit here, and we'll adjust this here. What I'm gonna do next is palpate your lymph nodes. So if you'll kind of turn your head at that angle. So what I'm gonna do here is the occipital. And if you have any pain or tenderness along the way, just let me know, okay?
Okay.
So occipital here. We've got the postauricular and the preauricular. Then we have the tonsillar here, okay? And then we have the submandibular and then the submental. Okay, and then we have the deep cervical, posterior cervical, and the, turn this way, and the supraclavicular. And I did not palpate anything with those lymph nodes, so I would do it on both sides, but for the purposes of this video, I'm not going to, but those were within normal limits, okay? So if you'll face back towards the front for me.
Okay.
Next, what I'm going to do is I'm going to fill your carotid artery one at a time, because you don't want to do them at the same time, but what I'm going to do is take the bell of my stethoscope and have you take a deep breath, and I'm going to make sure there's no bruits heard, okay?
Okay.
And that would be an abnormal finding if we were to hear a bruit, so.
Okay.
First, I'm going to palpate. Okay. Take a deep breath. Deep breath. Good. Okay, so bilaterally the carotid pulses are strong, within normal limits. There's no bruit heard, so that's good. That's all what you want to expect. Okay.
Good.
All right. So now we can, since we're right here, I'm going to go ahead and do your cardiovascular, your heart sounds. Make sure that everything sounds okay there.
Okay.
So what I'm going to do now is we're going to listen to the landmarks on your chest. I'll go ahead and tell you what we're listening for. At the right intercostal, second intercostal space to the right, sternal border, we're going to be listening to the aortic. And then we're going to move over here to the left, second intercostal space to the left, sternal border, and that's your pulmonic, okay? And then we go down here to the third intercostal space to the left, and that's your Erb's point. And then we would want to go down and listen to the tricuspid, and that's the fifth intercostal space, mid-clavicular line. And then we go to the mitral, which is down here at the fifth intercostal space, okay? So I just want to make sure that everything sounds okay with that. So that's what I'm going to be doing, okay? Do you have any questions so far?
Nope.
Okay. Good. Okay, S1 and S2 present. Your heart sounds are strong, rather regular rhythm. And I didn't hear any murmurs or anything abnormal, okay? So that's all good.
Good.
And if you want to, we can go ahead and listen to your breath sounds. If you'll turn around here, kind of where you see. Yeah, perfect. That's good right there. So what we're going to do here is I'm going to listen to your breath sounds and do a little bit of percussing and make sure I don't hear anything abnormal, okay?
Okay.
And on the heart sounds, what I would do is, for the purposes of this video, I didn't do it, but we would listen for a full minute in each location on the front, okay? So. You can take some breathe regular, and then when I'll tell you when to take some deep breaths as I get towards the bottom here, okay?
Okay.
You can take some deep breaths. Deep breaths. Good. Okay, just stay right there. Oh, well, actually, let me, could you say 99 for me?
99.
One more time?
99.
Okay, perfect. So what I was checking there is for tactile femoritis. So now I'm going to percuss here. Okay, good. And then we want your chest diameter, the anterior and posterior, to be a 1-to-2 ratio. And you can take a deep breath for me, please. Just like normal. Okay, just breathe normally now. Inspiration is greater than expiration, and it is 1-to-2 ratio. Okay, you can sit back over here on the bed, and so we can see that there. Okay, and now what I'm going to do next is I'm going to have you, we'll have you lay flat so I can assess your abdomen. So just kind of like that, and then we're just going to lift up your shirt here. So what I'm going to be doing is I'm going to inspect first and ask, then I'm going to listen, and then I'm going to feel and then percuss for anything. So as you can see, there's no bruising or varicosities, no striae. The abdomen is flat. So what I'm going to do is I'm going to listen for bowel sounds in all 4 quadrants, and on your right side is your liver, your right kidney, and then over here on your left is your left kidney. So if you feel at any point pain or tenderness, just let me know, okay?
Okay.
All right. So first, like I said, it's minimal hair. It's flat. I'm going to go ahead and listen to your bowel sounds. We want to hear some bowel sounds. Good. Okay, so any tenderness?
Nope.
No tenderness. Okay, good. All right, you can sit up now. So the bowel sounds in all 4 quadrants were within normal limits. I heard they are a little bit hyperactive. I heard it within 5 to 10 seconds. So, but you don't have any pain or tenderness in those areas, correct?
Correct.
Okay, so that's good. Now what I'm going to do is I'm going to assess your, just your arms and your skin. So if you'll hold out your arms for me, please. Okay. And there's no bruising. The skin is warm, dry, and intact on this arm. Warm, dry, and intact on this arm as well. No tattoos or piercings. So no ear piercings, no body piercings, no tattoos, no marks or bruising. Can I take this watch off? Or can... Okay, and and then the legs here, warm, dry, and intact, no tattoos, scars, piercings, anything like that. Okay, perfect. Okay. All right, now what I'm going to do is check for your pulses here, the radial pulse and the brachial pulse. Okay, good. Bilaterally, the pulses are strong, 2+ on the grading system, and equal. And now, have you had your tonsils out?
No.
Okay, I'm gonna look in your mouth one more time. I forgot one thing. Open up. Okay, so the tonsils are present, and they are a 2+ on the grading system. So, okay. Now where was I? I was at your skin. Okay, so the pulses are equal bilaterally. The skin is intact, and no tattoos, piercings, and your. Do you have any questions?
No.
Okay. Well, that concludes our interview. So thank you very much.
Yep. You're welcome.